Cancer, in its simplest terms, is a disease of uncontrolled cell growth. This abnormal growth can occur in any part of the body, leading to the formation of tumors and potentially spreading to other areas. When this uncontrolled growth originates in the cervix, the lower, narrow end of the uterus that connects to the vagina, it is known as cervical cancer. This type of cancer can have serious implications for a woman's health if not detected early. The cervix, a vital part of a woman's reproductive system, plays a crucial role during childbirth, acting as a gateway between the uterus and the vagina. It must dilate to allow the passage of the baby during delivery. It's composed of two main parts, each lined with different types of cells: the ectocervix, the outer part, and the endocervix, the inner part. These cells can undergo changes that may lead to cancer. Cervical cancer develops when cells in the cervix grow abnormally and invade nearby tissues. This invasion can disrupt the normal function of the cervix and spread to other parts of the body. This process, often slow and gradual, can be influenced by various factors, with the human papillomavirus, HPV, playing a significant role in most cases. HPV is a common virus that can cause changes in cervical cells. Understanding the nature of cervical cancer, its origins, and its potential impact is the first step towards effective prevention, early detection, and timely treatment. Regular screenings and HPV vaccinations are crucial in reducing the risk of developing cervical cancer. Cervical cancer is broadly classified into two main types, depending on the type of cell where the cancer originates: squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma, the most common type, arises from the thin, flat cells, squamous cells, that line the surface of the ectocervix, the outer part of the cervix. These cells are similar to the cells lining the skin. Adenocarcinoma, the second type, originates in the glandular cells that line the endocervix, the inner part of the cervix. These cells are responsible for producing mucus. Each type of cervical cancer can exhibit different behaviors, growth patterns, and responses to treatment. Accurate classification is crucial for determining the most effective course of action. In its early stages, cervical cancer may not present any noticeable symptoms, highlighting the importance of regular screenings. However, as the disease progresses, certain signs and symptoms may arise, serving as warning bells that warrant immediate medical attention. Abnormal vaginal bleeding, one of the most common symptoms, may occur between periods, after intercourse, or after menopause. Increased vaginal discharge, often watery, blood-tinged, or foul-smelling, can also be an indicator. Pelvic pain, especially during intercourse, or pain in the lower back, legs, or pelvis, should not be ignored. Unexplained weight loss, fatigue, or loss of appetite can also be associated with cervical cancer. It's important to remember that these symptoms are not exclusive to cervical cancer and can be caused by other conditions. However, any unusual symptoms should be promptly evaluated by a healthcare professional to rule out any serious underlying cause. Diagnosing cervical cancer involves a multi-step process that begins with a thorough medical history, where the doctor asks about the patient's symptoms, risk factors, and family history of cancer. This initial step is crucial in understanding the patient's overall health and any potential warning signs, and pelvic examination. During the pelvic exam, the doctor visually examines the cervix for any abnormalities, such as unusual growths, lesions, or discoloration. This visual inspection helps in identifying areas that may need further investigation, and may perform a Pap test. A Pap test, also known as a Papa-Nicolau test, is a screening procedure that involves collecting cells from the cervix using a small brush or spatula. This test is essential for detecting early changes in cervical cells that could indicate the presence of precancerous or cancerous conditions. These cells are then examined under a microscope to detect any precancerous or cancerous changes. The microscopic analysis is performed by trained cytotechnologists and pathologists who look for abnormalities in the cell structure. If the PAP test results are abnormal, or if other symptoms suggest cervical cancer, further tests are necessary. The doctor will discuss these results with the patient and explain the next steps in the diagnostic process. A colposcopy, a procedure that allows for a magnified view of the cervix, may be performed to identify suspicious areas. This procedure uses a special instrument called a colposcope, which provides a detailed view of the cervix and helps in pinpointing areas that may require a biopsy. Biopsy, the removal of a small tissue sample for microscopic examination, is the definitive way to diagnose cervical cancer. The tissue sample is carefully analyzed to determine the presence and extent of cancerous cells. The biopsy results provide crucial information about the type and stage of cancer, guiding treatment decisions. This information is vital for developing an effective treatment plan tailored to the patient's specific condition.